There are times whereby you keep treating urinary tract infection and some sexually transmitted diseases, and these infections keep reoccurring back. And you'll be wondering if you're not using the right drug or you have not taken the right step. Of course, you've been using the right drug and you've been taking the right steps, but there is something you have been missing. And that's what I'll be telling you in this video. Do well to watch this video to the end. Also like, share, and comment on this video so it can reach out to others. Before going further, what are sexually transmitted diseases and what are urinary tract infections? As the name implies, sexually transmitted diseases, these are diseases you get from an unprotected sex with an infected person. I mean, infections that can be transmitted through sex. That's what we call sexually transmitted diseases. Now, we have HIV, we have gonorrhea, we have syphilis, we have genital wart, we have herpes, different kinds of infection that can be transmitted through sexual means is what we call sexually transmitted diseases. And urinary tract infections are also infections that affect the particular tract in which urine comes out. Where you'll be urinating and you'll be feeling pain, you'll be urinating and you're having some kind of burning sensation while you're urinating. It's all caused by urinary tract infection. Now, there are different kinds of sexually transmitted diseases, and there are also different types of urinary tract infection. While treating this infection, there are some basic precautions you are supposed to take. Some of you might have been neglecting these precautions you're supposed to take while treating either sexually transmitted diseases or urinary tract infection, which you all know as toilet infection. Now, one thing you must do is to treat both partners. If you're having that infection, that means your partner is also having that infection. If at all you've been having an unprotected sex with your partner, that means your partner is also having the same infection. So while treating this infection, you need to treat yourselves together. Because if you don't treat yourself together, after treating yourself and you are treated successfully, your partner might still give you that infection. So you'll be treating and you'll be noticing that infection is not still going, and you'll be wondering what's the cause. And for some of you that have multiple sex partners, you might be treating and you still get it from another sex partner because it's a thing of cycle. If you have 3 people or 4 people that you're having sex with, you share it all of them. So if you just treat one person, the other person will still give it back to you if you still have an unprotected sex with them. So it's advisable you treat both partners. Now, another thing you must do is to avoid sex during that period in which you're treating yourself. Now, when you're treating yourself, you're not supposed to have sex again within that period. You shouldn't have sex, stay off sex to ensure that the treatment regime works perfect. The other thing you're supposed to do is to ensure that the drugs you are using are from registered and recognized pharmaceutical industries, because recently there are some drugs that have been produced which are not registered with either NAFDAC or any other recognized pharmaceutical industries. So these drugs might be sold to you, and after taking them, you might be buying them every time and they will not work for you because they are not original. So make sure that the drug you're buying are original. And sometimes drugs alone might not work by themselves. You need to ensure good hygiene of the private part. If your vagina is dirty, infections will thrive more because infections thrive in dirty environment. They love places that are dirty. In fact, they multiply more in places that are dirty and moist. So if you're that kind of person that wear panties for 2 days, 3 days, 4 days, as the case may be, change your panties at least twice a day to maintain good hygiene of the private area. That place needs cleaning than any part of the body. So the other thing that most of you might have been doing and you think is normal is carrying out self-medication. Now, self-medication have a lot of dangerous effects. It can cause a lot of problem to the body. Because most of you feel it's every infection you have that can be treatable by ceftriaxone, azithromycin, doxycycline, and other drugs like that. Now, infections have different causes. There are infections that are caused by virus, there are infections that are caused by fungi, there are ones that are caused by parasite, there are ones that are caused by bacteria. And some drugs are meant to treat just bacterial infection, while some are meant to treat just viral infection, and some are meant to treat just yeast infection, and some are also meant to treat just parasite infection. You get? Now, when you keep taking antibacterial infection on infections that are caused by virus, it will not work, and you keep saying, I've been treating, and to no avail. You'll be wasting your money and nothing will happen because you have not been using the right drug, or you have not been taking the drugs the way you're supposed to take. So avoid self-medication. Visit a medical professional to ensure that all your treatments are according to standard and treatment are according to medical profession, so you can get the result you want. So if you enjoyed this video, do well to follow my page. Also like, share, and comment on this video. I'll be talking about different topics that will be beneficial to your health. See you next time.